So why is a 5'11", 165-pound guy without diabetes wearing a glucose monitor? So the CDC has linked obesity and being overweight to 13 different types of cancers. Diabetes is a really common problem. Again, it's 38 million people, or 11% of the population has diabetes. And it's estimated that it's 15% if you include those that are undiagnosed. So that's a really large percentage. But if you add up pre-diabetes, we're talking 1 in 3. So again, you look right, you look left, the likelihood is that at least one of those people is going to have pre-diabetes. I'm Dr. Patrick Dennard, and today's episode is why everyone should try a glucose monitor. So I'm going to talk about why I'm wearing this monitor here. So why is a 5'11", 165-pound guy without diabetes wearing a glucose monitor? And I think there's several benefits to trying this. I think it'll give you some information. So we're going to talk about the evidence of why this is the case and why you need to be thinking about tight glucose control. And I'm going to share with you some of my personal experience. Today's podcast is sponsored by Complete Surgical Nutrition. The average American will have 6 surgeries in their lifetime. Evidence shows that nutrition is an important part of recovery. Supplementation can improve speed of recovery and lower the risk of complications. CSN was formulated by surgeons to help optimize your recovery after surgery. If you or a loved one are having surgery, more information is available at www.completesurgicalnutrition.com. So I think one of the things to start to think about is, has anyone had that midday crash, right? In the middle of the day, somewhere 2-3 o'clock, you have this major lull. And what you'll see is that this often actually relates to a drop in your blood glucose level. And if we look around, we see that Americans are literally poisoning themselves, right? Our level of obesity is continuing to rise. And with wealth, obesity follows, and that's what's happened to us. And we're seeing increasing rates of cancer occur. And some of this likely relates to glucose control. Now, if we can learn to monitor this and lower that risk earlier in life, you can have benefits long term. So maybe many of you are young or middle-aged and you're thinking and telling yourself, this doesn't really apply to me. I don't have diabetes. I'm healthy. And I have a couple of responses to that. First of all, you probably underestimate your risk. And the risk of actually getting diabetes and having elevated glucose levels that are pre-diabetes increases with advancing age. Secondly, diabetes as we define it is based on a couple of different approaches. Essentially, it's elevated blood glucose levels, but the levels that we have probably underestimate the true impact on people. In other words, what I'm saying is that the evidence is increasingly suggesting that you should try to be below these targets that are defined that physicians give and say, here's where you meet. And it's like anything in life. It's not as if you just all of a sudden cross a threshold and you have it or don't. There's a spectrum or gradation. And the lower or further away you can be from meeting that level, probably the better off you're going to be. The third thing that I would say is that modification of behavior has the greatest benefit if you develop a pattern over time. So if you wait to address this later, a lot has occurred early in your life. And currently, what happens in medicine is we wait to treat a disease or a problem until it occurs. And I hope, as an orthopedic surgeon, that we continue and move toward focusing on prevention at an earlier time point. So if you develop these habits of thinking about your blood glucose level at an earlier time point, those are going to add up over time. It's just like compound interest. If you invest in your 20s or 30s, you're going to have a lot more later. Well, if you learn and get feedback on your blood glucose levels now at a younger age, this can benefit you long term. Now, this doesn't mean if you're older, you shouldn't consider something like this. Say you're in your 50s or 60s, it's definitely something you can get feedback in and improve your quality of life. But I think particularly for younger individuals who are thinking, I'm healthy, I can drink and eat whatever I want. Well, you're not seeing things that are occurring because we don't see what's happening on the cellular level. So let's dive into some of the stats. I talked about this a little bit in the muscle podcast earlier, but to review, diabetes is a really common problem. Again, it's 38 million people, or 11% of the population has diabetes. And it's estimated that it's 15% if you include those that are undiagnosed. So that's a really large percentage. But if you add up pre-diabetes, we're talking 1 in 3. So again, you look right, you look left, the likelihood is that at least one of those people is going to have pre-diabetes. I remember in college when I was a biology major, my instructor in cellular biology class said, look left, look right. One of the 3 of you is going to have cancer in your lifetime. Now, it's hard not to look at that similar statistic with diabetes and see an association. And when I was in medical school, I was taught that cancer was a genetic diagnosis. That is, it was related to your hereditary, and that there was some risk factors that had to do with affecting genes. But increasingly, we now recognize that a lot of this is habit-based. And one of the biggest things is your blood glucose levels. So the CDC has linked, actually, this article that will be in the show notes was published, and the CDC has linked obesity and being overweight to 13 different types of cancers. These include breast, colorectal, endometrial, esophageal, gallbladder, gastric, liver, meningioma. Meningioma is a cancer of the brain. Multiple myeloma, which is a cancer of your blood cells. Ovarian cancer, pancreatic cancer, renal, and thyroid cancer. So obesity in itself has been linked to these cancers. Now, what occurs with obesity is typically people have blood glucose levels that are elevated because over time, as they are increasingly exposed to elevated glucose levels, they develop insulin resistance. And those glucose levels spike and they cause problems at the cellular level. So now there's a couple of important things that I want you to understand on this. The first is that you can have a normal glucose level. That is, if I take a blood test and monitor your glucose level, you can have an elevated insulin. Now, insulin is the hormone in your body that when glucose levels go up, drives glucose out of the bloodstream, right? But you can have normal glucose levels and still have elevated insulin. In other words, elevated insulin levels precede elevated blood glucose levels. So there's a lot of acronyms that are associated with this, and I don't think it's important to understand every certain mechanism, but there's things like RAC1 and insulin-like growth factor that have been associated with cancer. But the bottom line is that insulin signaling promotes cell division. So the more exposure you have to your blood glucose levels being elevated, the more insulin is around, and the more that can lead to cell division. And as we know, cell division is bad because that is a promotion of cancer. So hyperinsulin, that is elevated insulin levels, not just obesity, has been associated with cancer risk and cancer mortality. This is one reason why increasingly people are talking about glucose being a fuel for cancer, and why people are now talking about diet, for instance, and really trying to limit foods that are going to drive your glucose levels high, because if you can control that, you then can help control the fuel for the cancer. Now, rather than thinking about how do I address the cancer and try to lower my blood glucose levels, how about we try to prevent that or lower our risk over time? So I think about this in two ways. One is the risk. So each event, that is, every time your blood glucose level spikes, that's a risk, right? It's a roll of the dice, and it may not be a high probability, but every time you do that, that's probably the risk. Again, we used to think about this in terms of just genetic risk, and cancer was a random event, but it's probably increasingly recognize that it's related to actually what you're consuming that increases that risk. Second thing is that glucose and insulin are fuel for cancer cells. So we want to try to lower that as much as possible. Okay, so I want to dive into some of my personal experience. So why did I decide to use a glucose monitor? Well, if you look at target goals, you'll see that a general level, according to the CDC, is to have a blood glucose level somewhere between 80 and 130. So as I became increasingly compelled by this information about blood glucose levels, both affecting my energy and being a risk for cancer, I decided to start monitoring this more closely. So I purchased a device called the Stelo device. This is something that I was able to get for $99 for a month's supply. I think that may seem like a lot of money or a barrier to people, but I think one of the takeaways here is that I don't know if this is something you need to do all the time, right? You can get a lot of information in a short period. And if you think about how you can spend $100, I think this is a really good investment in your long-term health, right? Just again, like the investment analogy, if you put a little here at the beginning, it's going to really add up over time. So I'd really encourage you to try this. So what I learned is that I had some surprising things. One was that it's not just something like sugar that drives your levels really high. So if you eat a candy bar, that's probably pretty obvious. But what you'll see is that you get feedback with food. So for instance, I noticed that if I have potato chips, a carbohydrate during the day, my blood glucose levels would spike dramatically. Some of these even surprised me. Like a common food that I would have would be a Cliff Bar, right? You would look at a Cliff Bar, it's a healthy food, but actually it has a pretty high carbohydrate load, and I would get a massive spike after that. What was really interesting to me was not just getting that feedback on seeing the level decline, is almost without fail, every time if I noticed I felt a little bit lower energy during the day, I would look and see my blood glucose levels were dropping. So these spikes are important because of what they do metabolically and driving your risk, but also it affects your energy levels. And I think if you try it, you'll see that as soon as you start to feel a little bit decline in the day, you'll see that that typically occurs 45 minutes or 60 minutes after you've had this blood glucose spike. Now, prior to trying monitoring, I would think, gosh, I'm just feeling a little bit low here, right? Like maybe I need a coffee or whatever. But actually, now this allows you to take that information and apply it back and say, well, you know what? Now this actually relates to what I ate. Because before you really wouldn't have an explanation or reason for that. But when you see that consistent spike after eating and the drop, you then know, okay, it's what I had earlier in the day. So it's not only feedback on your energy levels, but it creates this accountability. And if you have this accountability and you can do this for a short period of time, you can develop a pattern of change that modifies your behavior. And the goal is to do this so that you have long-term success. This might be something that you could do for a couple of weeks or a month and learn a lot. I would encourage you to try different foods, try different activities around it and see, and then you could even come back to it several months or a year later. I don't think this is something you have to do consistently, throughout your life. Of course, some people are really going to get really excited about it and really try to have tight control. But I think if you learn a lot, you can then have that translate very far. So once you understand this information and are compelled to try to lower your blood glucose levels, there are some different tools you can use or probably have heard about to drive your blood glucose levels down or prevent those spikes. You see, for instance, the Glucose Goddess talks about these hacks. So I thought it would be interesting to dive into some of these hacks that you can use to lower your blood glucose levels and prevent these spikes, to both lower the risk of metabolic disease over time, including cancer, but also improve your energy levels. So one of the things that's talked about is vinegar, right? Can you just take vinegar prior to a meal and drop your blood glucose levels? Well, a 2015 study published in the Journal of Diabetes Research, looked at this. And what they did is they did 30 milliliters, which is equivalent to 2 tablespoons of vinegar prior to eating. And it was just 5 minutes prior to eating in these individuals. And that resulted in a 6% reduction in glucose levels post-eating. So it was a small difference. It wasn't a major difference. If you have the ability to take vinegar prior, that's certainly beneficial in lowering your blood glucose levels. Now, that's probably not super practical in all places to have vinegar available, but one thing that you can think about that's really common is just using a oil and vinegar salad dressing, right? If you have a vinegar-based salad dressing, perhaps having it at the beginning of your meal is beneficial. Now, along with that, order of food in which you eat is really, really important. So essentially what you want to do is avoid eating that carbohydrate-rich food at the beginning. So a very common thing is that we go to eat at a restaurant, and what do you provide? You provided bread. Well, that is actually the worst thing you can do. You should probably avoid that bread. If you're going to have it, you should probably have that with butter or oil, but ideally you avoid that. Now, there's been studies that have looked at the order of food. For instance, there was a study in the Journal of Diabetes Care. They took 11 patients, so a small number, with type 2 diabetes, and they gave them bread and orange juice, followed by chicken breasts or vegetables. And then they reversed that a week later. What they found was that glucose decreased by 29 to 37% at 30 minutes and 67 minutes respectively. So essentially at a 30% reduction in blood glucose levels just by switching the food order. So if you consume protein, especially fiber as in vegetables at the beginning, you can lower your blood glucose levels. Then have the bread at the end if you feel like you want that, and to treat that as a dessert, in other words. And that's a bigger number than you saw with the vinegar. And this is why I also talked about having, if you're going to have vinegar, use that as a way on salad, because you're going to have the vinegar, plus you're going to have vegetables at the beginning. That would help drive down your blood glucose levels. So many times salads presented at the beginning of a meal, taking bread aside, and that actually is a really good way to think about it, as opposed to some people like to have it at the end. You should probably try to do it at the beginning, again, with a vinegar dressing. Now, in the prior podcast, we talked about the importance of muscle building and strength. And one of the things I highlighted was glycemic control. And exercise has a major impact on lowering your blood glucose levels. For instance, a study in 2018 out of the University of North Carolina looked at a systematic review. So again, systematic review is combining a bunch of information to try to power it. Because if you have a small number of patients or people in a study, sometimes you can say that study might be a little bit too small. If you combined it, that can make that study simply more powerful. So they looked at 12 studies, 135 participants. 20 minutes of walking led to a 22% reduction in blood glucose levels. So simply if you eat your meal and you go take a short walk at the end of that meal, perhaps with your partner, catch up, you're going to have a connection benefit as well. You're going to have a very significant drop in your blood glucose levels. Now, what's interesting is they looked at the type of exercise as well in this study, and they looked at short-term blood glucose levels. So an hour and a half to 4 hours after a spike. If people did low-intensity exercise, that is something like walking overall, because it was an average, that 22% that I talked about earlier, low intensity was a 4.2% reduction. So simply going walking is going to lead to a reduction equivalent to taking vinegar at the beginning. If people did high-intensity exercise, it was a 26% reduction. And interestingly, the best reduction was with resistance training. That was a 30% reduction in blood glucose levels. So imagine rather than spiking to, say, 160, you now have a 30-point reduction and you're down to that 130 level. Now, hopefully your spikes aren't even going that high, But resistance training has a big impact on glucose or glycemic control. And that's why it's so important, as I talked about earlier. The other thing that's really important here is the timing. So you want to have exercise, if you're going to use this as a tool to lower your blood glucose levels, you want to do that in a short period close to your exercise or close to your meal. So if you initiate within an hour of the meal, it's about a 30% reduction at the best, versus if it's an hour to 2 hours later, it's a 15% reduction at the best based on this study. So ideally, you have resistance training and it's within an hour of consuming that meal. So the take-homes from this information are a couple here. Number one, glucose control is really important for your long-term health. And it's hard to see this on a daily basis, but if you look at the evidence over time, it really increases your risk for metabolic problems and specifically cancer. Secondly, if you look at actually attempting to monitor your glucose levels, which is quite simple, I think you'll find that it affects your energy levels a lot. And when people talk about that drop during the day, if you're paying attention and using a monitor, you'll probably see that relationship to eating. And it's said very commonly that you are what you eat. And I think you'll see that evidence coming right back to you to give you hard data to really hit that home. Lastly, there's several hacks that you can use to lower your blood glucose levels. You can eat salad first, adding vinegar dressing. You could, of course, do vinegar on its own, but order of food is more important probably than vinegar. And the most important thing is exercise. At a minimum, if you're going to have a large meal, having a short walk afterwards is beneficial. If you're at work, you're having lunch, get up and walk around. If you are traveling and you're on a plane or something like that, you could simply do exercise with your calves to move your muscle immediately afterwards and help drive blood glucose into the muscle away from the bloodstream. So hopefully this information gives you some motivation to think about why, even if you do not have diabetes or prediabetes, you should really consider using a glucose monitor. I think it'll go a long way to improving your health, perhaps even your mood and energy levels. If you enjoyed this podcast, please like it, please subscribe, and if you're so compelled, leave us a 5-star review. In future episodes, we're going to talk about bone health and also dive into the science of success and happiness in career.